although I attend at least one or two of this size meetings every year, it's unusual to find a breakthrough technology. What we're doing today is meeting Heather, who represents Canary, which is truly breakthrough technology. In the past, when I have someone come into the office, a tooth's bothering a little bit, or we see a crack in a tooth, all I have to do is look at it and try and figure out, should I put a cap on this tooth? Should I leave it alone? And then I use my experience to make that decision. Sometimes I'm right, sometimes I'm wrong, and the tooth fractures. In cases, the tooth can be lost. So Heather, tell us about Canary. And the first thing I'd like to know is, why do you call it Canary?
That's an interesting story. In the coal mines, many, many years ago, they used to send a canary in to see whether they were safe. And if the canary survived, it was early detection to say whether it was safe for the coal miners to go into the coal mine or not. So the canary represents early detection. So it's looking at a tooth and the decay in the tooth 4 times sooner than we can see it on an X-ray. So it's definitely early detection.
Then, if you would, can you show us how it works?
Absolutely. The Canary is a low-level laser. It uses 2 different techniques. So it's heat and light pulsing down into the tooth to give us a reading or a measurement. In this particular tooth, we have a craze line or a crack line into that tooth, and it goes very much subgingivally. The laser has a tracking light, so we're pointing it at the tooth, and we're taking a canary reading straight away. So right now it's pulsing. It's 5 seconds. It's sending in the heat and light into the tooth. Now it's reading the data. 56. And we're getting a 56. So that tooth, this is your canary scale. The canary scale is 0 to 100, 0 to 20 being within the healthy range, and 20 to 100 being decayed. And as the number increases, so does the level of decay, or in this particular case, the integrity of that tooth in the crack line. So we can see the crack line in that tooth, and I'm getting a reading of 56. So there's definitely something going on. In days gone by, when we'd be looking at that tooth, it's between, obviously you can't see it, going on. In days gone by, when we'd be looking at that tooth, it's between, obviously you can't see it.
Thank you. That's really interesting. So, when you're going to look at anything to purchase, the next question would be, how much does a canary cost?
The technology is $15,000. Meaning, is that what you're asking? And the reason that it is as costly as it is because we had to take the technology from a large room down to a small room. So the dentist that created it 13 years ago was sitting in the dental chair working on a patient, and the patient was a physicist. So he said to the patient, "Boy, I sure wish I could see under this filling." And the physicist said, "Well, you know, I can do that." But it took them. The technology was 10 by 10. It was a very large room, and it was used originally to determine whether there were faults in the metal of airplanes. So he took that technology, the photothermal radiometry and luminescence, and created a photon receptor that's this big.
That's amazing.
That's pretty amazing stuff.
So, $16,000, that's a lot of canaries.
That's a lot of canaries.
And we've got to decide, in every practice, every dentist has to decide the cost benefit of a piece of equipment. So there would be 2 reasons that I would not buy any piece of technology for the office. One, because we don't absolutely need it, and in a case like this, 3 years from now, it's not going to cost $15,000, $16,000. It's going to be a lot less.
More than likely.
I could misdiagnose that piece of years ago to have nothing to replace what you have.
Absolutely. Absolutely.
And the other reason that I wouldn't buy new technology is I'm not sure that new technology is really going to work. Sometimes it's just a good salesman.
Absolutely.
But in this case, this makes sense. And this is something we can work with. And this will become one of the new pieces of us moving ahead and making it easier and better.
It's better dentistry. It's practicing better dentistry. It's the only system on the market that can do exactly what you're saying. Just look at cracks, look around amalgams. Those old fillings that we have, it's hard to determine whether there's decay there or not. Radiographically, we can't see that on an X-ray. So this is really the